Hello, good afternoon, everyone, and welcome to our workshop where we want to introduce our cost action European Burden of Disease Network. My name is Brecht de Vleeschouwer, and I'm chair of the cost action, together with Milena Santric, who is the co-chair, and we will be guiding you during this workshop. If I can have the presentation. So the aim of the workshop is to introduce our activities and to encourage you to find out more and maybe join our cost action. So we are a network of currently more than 200 people from across Europe and beyond who have an interest in using the burden of disease methodology to study the impact of diseases, injuries, and risk factors in different countries of the world. With our network, we are able to foster capacity building and methodological developments that will allow us to further establish the method of burden of disease assessment in the different countries. Later on, we will be giving you more details about our specific activities and how you can join as a member. But in general, we are divided into 5 different working groups, and each member is asked to sign up to at the same time one of these vertical working groups, which focus on specific applications of the burden of disease methodology. So we have NCDs and injuries, led by Juanita, infectious diseases led by Sarah Pires, and risk factors led by Dietrich Blass. So these show the broad spectrum of applications where the burden of disease methodology can be applied. And we define the burden of disease methodology as the use of DALYs, disability adjusted life years, to quantify the health losses from these possible causes of ill health. In addition to this, we also have 2 transversal working groups that focus on horizontal overarching aspects of burden of disease. So we have a group focusing on methodology, led by Helena van der Lippe, and a 5th group focusing on knowledge transfer, which is led by Henk Hilderik. And because when doing burden of disease, we are very often confronted with methodological challenges. We each try to find solutions to these challenges, but it's of course very useful if we can get together and share our experience and expertise. And knowledge transfer is also very relevant because we of course want these burden of disease estimates to be used to have an impact on policy. So we also want to study the processes that can lead to the translation of the numbers into action and policy. So as mentioned during this workshop, we will give you some insights in how we work, what we want to achieve, and how you can contribute. And we'll do that by starting with a talk by Juanita, who will explain how we aim to support interaction between different ongoing burden of disease efforts across Europe and beyond. After that, we will have a talk which unfortunately cannot be given by Ian Grant because he fell ill some days ago. So I will be taking over from him. And here we will explain how we want to foster methodological advances and support technical capacity building within our action. And last but not least, we will have Elena Palari, who will give us some more insights on the knowledge translation and policy transfer activities of our network. And we'll give you some initial results from a workshop that we held a few months ago. But even though this is an online version of the workshop, we also want to learn from you, of course. And for this, I would like to give the floor to Milena to tell you a bit more about how we want to have some interaction during this workshop. Milena?
Hello, dear colleagues. It's very nice to see that we have a significant number of attendees. This is very good that we have so great interest in our workshop. Since we would like to have as more interaction as possible, we would like you to be free and ask questions that are most important to you for this session. So I will try to make all of these questions public and try to get responses from our presenters. Our first presenter is Dr. Juanita Axma. Dr. Anita is an assistant professor at the Department of Public Health of the Erasmus University in Rotterdam, and her research interests include health-related quality of life, burden of disease methodology, and injury. Juanita, the floor is yours.
Thank you, Milena. I'm giving this presentation on behalf of Marek Maidan, Sara Montero Pires, and Ricardo Asunción, but I will be the one who is speaking today. So burden of disease studies are performed a lot because they answer a lot of interesting questions or important questions. One of those questions are, what are the most important diseases in a country? Which risk factors are the strongest contributors to disease and death? How is the impact of different diseases evolving over time? And how does it compare between and within countries? So these are all kinds of questions that can be answered by burden of disease studies. Well, currently there are many burden of disease activities in Europe, but it is very scattered. There are experts from diverse professional backgrounds, also looking into a diverse range of studies looking at a particular subject, studies that are more a general burden of disease study, looking at all causes and diseases in a country. And there's little interaction between these experts because every one of them is in a different country and they all look at their own subject in their own way. And because of this little interaction, the European Burden of Disease Network has been performed. So the scattered burden of disease landscape that causes that there is limited harmonization of existing burden of disease efforts. And there's also variable technical capacity at country level. And there is no platform to support methodological advances. So there's no way of interacting about these subjects. And there's also limited understanding of knowledge translation and policy transfers. And this is essential to then use the information that is derived by a burden of disease study. And that is why there's now the European Burden of Disease Network. This is a cost action, and a cost action is a network that is dedicated to scientific collaboration. And the European Burden of Disease Network is a technical platform for integrating and strengthening capacity in burden of disease studies across Europe and beyond. And below here you see again the picture that Brecht already showed. This was in the before COVID times when we could all stand within 1.5 meters distance from each other. This was one of the meetings that we had in Denmark this year. So the European Burden of Disease Network is a cost action, as I already mentioned, and the lifespan is from October 2019 until October 2023. There's a website dedicated to this action, and there's also a Twitter account. So in case you would like more information, you can find it at this website. I will show the website several times, so if you want to write it down, you have enough opportunities. The objectives of the European Burden of Disease Network are to bring together experts and expertise across different domains of burden of disease studies and transforming the currently scattered burden of disease landscape into one transnational team. One of the other objectives is to compare and harmonize methods and approaches for burden of disease estimates, identify critical knowledge and data gaps, and set up studies for which international coordination is needed. It's also an objective to serve as an advocacy group for the burden of disease approach in Europe. Other objectives are within the scope of capacity building. So one of the objectives is to build and increase capacity in burden of disease assessment across Europe, to serve as a technical platform where knowledge and expertise can be shared among established and emerging researchers, and to promote an interdisciplinary approach that integrates knowledge translation in the classical burden of disease framework. So the cost members are these countries that are listed here. So these are the participating cost member countries that are currently in our European Burden of Disease network. There are 38 cost members and one cost cooperating country. And all of these countries, except for Czech, are included in our cost action. The activities of our European Burden of Disease network are to map all the existing burden of disease studies. So that means that there's a survey that has been performed among all the cost action participants to assess which burden of disease studies have been done or are currently ongoing. And over 70 studies have been included in this survey in 12 countries. Another activity is to identify the various domains for which burden of disease has been assessed, to highlight methodological differences as well as similarities between all the studies that have been performed or are being currently performed, and to facilitate improvement and harmonization of methods and approaches. So if you compare the results of different burden of disease studies, you can actually compare them because they have the same methodology, or at least as much as possible same methodology, so you also actually can compare the results of the studies. The deliverables, one of the deliverables of the European Burden of Disease Network is to have a burden of disease database. This lists all past and current burden of disease activities, and it will be continuously updated. This burden of disease database can also be found on the cost action website that is shown here. One of the other activities that is also ongoing at the moment is to facilitate regular meetings and workshops. This will be done during the whole lifespan of the action. And these can be large meetings with many cost member participants, but also smaller meetings like the one here, the digital short-term scientific mission meeting that we recently had. The aim of the European Burden of Disease Network is to unscatter the burden of disease landscape. And this means that we move beyond the currently scattered burden of disease landscape and to increase the interaction between professionals and burden of disease efforts. If you want more information on the European Burden of Disease Network, you can look at the website. You can also follow us on Twitter. You can sign up for newsletters. And if you want to join the Burden of EU network, you can also visit the website where there's a very nice page that gives all kinds of information about joining the network. Thank you very much.
Thank you, Anita. Now I want to give a word to the auditorium. We appreciate very much to hear your first impressions of this very interesting presentation, very clear. And also please be free to comment and pose a question for our presenter. So I just want to add that all presentations of this workshop are available through our website as well. So if we do not have at the moment any question, we can proceed now. Or I can also try to refresh the question that Brecht has mentioned, and that is, please think about the most important obstacle in your country regarding knowledge translation of burden of disease studies into the policy-making process. Now we have the next presenter. The next presenter is Brecht, and Brecht is a senior epidemiologist at Cinsano, the Belgian Institute for Health, and he's a professor of risk analysis at Ghent University. He's also chair of the Cost Action European Burden of Disease Network. Brecht, the floor is yours.
Okay, thanks a lot, Milena. So as mentioned, I'm giving this presentation on behalf of Ian, who wasn't able to attend today. And this presentation has been compiled together with several other colleagues from the core group of the Cost Action, Dietrich Plas, Elena van der Lippe, Tina Lesnik, and Jana Idavijn. And the aim of this presentation is to give you some insights on how our cost action can help to strengthen capacity building in burden of disease methodology and can help work towards methodological advances. So we will start by saying that one of the key aims of our cost action is indeed to integrate and strengthen capacity in burden of disease assessment across Europe, but also beyond. So while the cost action and the cost association are linked to the European Commission, there's of course a strong focus on Europe, but this doesn't mean that we cannot have an international perspective. So we are open to anyone, to any participant from within Europe and beyond. Anyone is able to join our network and to learn more about our activities and contribute, of course. And as mentioned, we have the different working groups, where one of these working groups, the methods working group, is focusing very explicitly on the capacity building and the development of burden of disease methodology. Okay. As Juanita already mentioned, we aim to bring together people working on burden of disease, people interested in learning more on burden of disease, so that we can start consolidating, integrating the current burden of disease landscape, which is a little bit scattered. We have different countries, different international organizations working on burden of disease, but we've seen that they don't always talk to each other, which is a bit unfortunate because many of the methodological challenges in doing a burden of disease study are common across countries and at international level. So there's really a lot that we can learn from each other. And we also realize that the best way to learn how to do a burden of disease study is to start doing a burden of disease study. So we want to encourage people to get involved, to pick up this methodology and to start somewhere, but to start implementing this so that they can learn as they go along. We Within our cost action, when we developed the proposal, we had suggested a few overarching key elements that we want to deliver that can help this capacity building objective. So we want to compile a list of burden of disease studies across Europe through our website, and this will soon become available. There will be a database of burden of disease studies listed by topic, by country, so that everyone can have a look at studies, can easily find the studies that are already conducted and learn from existing experiences. We also want to work towards the development of reporting guidelines for burden of disease studies, for DALI calculations in particular. And these reporting guidelines can play an important role in capacity building because they help you understand what the key methodological aspects are of a burden of disease assessment. It will also help us to better interpret, compare studies that are done in different countries or settings, because we will be able to easily list up and unravel the choices and assumptions made in these different studies. several countries are implementing or have the idea to implement a national burden of disease study. So this takes the whole idea to the next level. And there again, we can learn from each other's experiences. So here we also want to develop a standardized roadmap that describes the key steps, the key points, the key methodological aspects of such a national burden of disease study, again, so that we can learn from each other and exchange our experiences. Um, the DALI calculation checklist is an idea that we had and that could become something similar as the Prisma checklist. So when we want to engage in a DALI calculation study, we can use this checklist to make sure that we have explicitly reported on all the methodological aspects and assumptions within our study. And finally, we also want to support active training. And to do that, we aim to develop standardized open access training material. I'll talk later on about our training schools, but we also have the ambition to continue this work beyond the 4-year lifespan of our action. And one of the ways that we aim to achieve this is to have a series of open access training material that could be continued after the cost action would have ended. Okay. Um, so these training schools, in general, the cost association, so cost actions, they support networks of researchers by allowing people to get together in meetings, smaller workshops, but also in training schools. And the cost association then provides reimbursement of costs for travel and accommodation, because we often have a lot of interest to meet each other, but the financial means aren't always available. So the cost action explicitly helps in that respect. And training schools are sessions of often 3 days, 1 or 2 weeks, with lectures and exercises organized by members of the cost action and directed at other members of the network who want to learn more about a specific topic. So this gives us the opportunity to really start developing course material, training schools in burden of disease assessment, going from the very basics to more advanced topics linked to burden of disease. Some time ago, we have conducted a survey within our network to learn more about the needs and the expectations of our members in terms of these training schools. So we have given them a series of options for possible topics and asked them if they would be very likely to attend in green, just likely to attend, or not likely to attend at all. And here you see a snapshot of some of the results. And this learned us that there's a very strong interest among our members to learn more about relatively advanced topics. So they want to learn how to calculate the burden of risk factors. So this is already a bit more advanced than the burden due to outcomes. They also want to learn more about the general concepts of foresight studies. So instead of looking at the past and the present with our burden of disease studies, we can also integrate this into additional studies where we aim to look at the future, where we aim to define scenarios, policy scenarios that can give us an indication of how of what the effect could be of certain interventions. In the list, we also had several questions very much dedicated to the global burden of disease study, so the GBD study conducted by the Institute for Health Metrics and Evaluation, who yesterday, I believe, released their latest series of estimates for the GBD 2019 studies. And many of our participants are already closely involved in the GBD study as collaborators, or at least have a very big interest in what the GBD study is doing. So they also want to learn more about the GBD methodological framework. They want to learn more about how they can use the available GBD estimates for knowledge and policy translation within their own countries. So we also aim to foresee strong links with IHME to help our members to achieve these expectations. One of the elements or suggestions was also to focus more on the general, on the basic concepts of the burden of disease approach. And this turned out to have a ranking or a preference somewhere in the bottom half of the list, um, which might be due to the fact that several of our members already have some level of experience with burden of disease. So they have a level of expertise that would not require such a basic introduction course. But at the same time, we also want to remain open for people who are new to the domain. So we still believe that it's important to also be able to provide this basic introduction to burden of disease and to the calculation of disability adjusted life years. So taking this into account, we had, before Corona hit, we had started thinking about our first training schools, and we decided conduct conduct two training schools early next year, um, which could have been hosted in Serbia, in Belgrade University, thanks to Milena. And one training school would focus on these general concepts, while a second one would focus more on advanced concepts such as these risk factors and forecasting studies. Um, so we will see how the situation evolves, and we might need to resort to an online version of these training schools. Um, this, of course, would be less easy, less practical than a face-to-face training school, but it would also maybe help us to already start developing our online course material. So we'll see how this evolves, but please keep an eye on our website. We will, of course, also send out a newsletter about this if we have more information. But this is definitely in the pipeline, and we will try to organize this early next year, some way or the other. Okay. I've talked a lot about the training schools, but a second very important, very unique also way of supporting capacity building are the short-term scientific missions, the STSMs. And short-term scientific missions are exchanges of researchers, of individuals, traveling from one institute, from one country to another country, to work with domain experts, focusing on a very specific project or activity. And so it would, for instance, allow you or one of your students to travel to another country and work for 1 or 2 weeks with an expert in burden of disease on an applied topic. And this is, of course, very powerful because it fosters one-to-one interaction um, between members of the network. It also helps to support ongoing interactions, ongoing collaborations that are already existing, but it will also help to set up new collaborations between research groups and entities. But of course, this is again something that is a bit hampered by the Corona context. So traveling from one country to another is, of course, less easy than it was before. Um, so we haven't been able to support a high number of STSMs yet. So far we had one STSM where Sarah Kucheri from Malta came to work with me in Belgium to look into the burden of diabetes in her own country. And we recently also had a virtual STSM where the colleagues from the Robert Koch Institute in Germany set up a series of web calls with several other experts to talk about specific burden of disease topics such as comorbidity and severity distributions. So hopefully, if the situation gets better next year, we will be able to support more of these physical exchanges. And to learn more about the eligibility criteria and how to apply, please feel free to have a look at our website here, or just send us an email, and we would be more than happy to help you in setting up your short-term scientific mission. Then the last slide. So I've talked about the training schools, about the short-term scientific missions, also about these deliverables that we want to deliver. Two final words here. So we also want to, and especially now because of the difficulties and the obligation to go towards online interactions, we also want to continue the interaction within our network through the regular dissemination of newsletters. And very recently, we introduced a new aspect on our website, the so-called spotlights, where we want to put our members in the spotlight. So here we welcome every member of our network to write a short narrative, like a blog post, about the work that they have been doing on burden of disease, or a recent project that they have initiated. So just to explain a bit more about what they have been doing, so that we can again learn from each other and get to know each other. So again, to conclude, we very much welcome everyone. If you haven't yet joined up, please have a look at our website and feel free to join us. Also feel free to follow us on Twitter, where we regularly post links to recent burden of disease studies and other activities that are going on. So with that, I want to thank you very much for your attention, and I will take any questions if there would be. I've also seen that in the chat, Dietrich has put the link to the special issue in the Lancet on the GBD 2019 study. So thanks a lot for that, Dietrich.
Well, thank you very much, Brecht. This was a very informative presentation. There are so many interesting details for different participants, those who are already members of the Cost Action and those who maybe want to be members for Cost Action. Can you, first of all, I would like to ask our colleagues from auditorium, do we have a question from them? I can't see Q&A, but I can see that only this discussion about the Lancet journal, but I would like to see whether we have questions regarding the presentations we have heard from Juanita and from Brecht. If we do not have such questions, I would like Brecht just once more to stress who is ideal member, future member of Cost Action. Is there a particular characteristic that participants should have so he can be a Cost Action partner or not?
Thanks, Milena. So the only particular aspect would be to be a living person with an interest in burden of disease some way or the other. So we are open to people who already have a lot of expertise in burden of disease, because of course we want to bring together people working on burden of disease, learn from the experts. But at the same time, we are also very much open to people who haven't yet been able to establish such expertise and who want to learn more about the methods. So we are equally open to people who want to learn more and learn from these experts and get together. We are open to people working in universities, in public health institutes, governments, NGOs, private sector. Anyone with an interest in burden of disease is more than welcome to join. So thanks, Milena.
Good. That's the answer we are all looking for, because that means that we are very open and very willing to critically examine all important aspects of the burden of disease and from different points of view. So we also would like to know. I'm thinking about that. So there are many plans for training schools. Did they understand well that these training schools will provide some kind of templates for every member, so she or he can try out the implementation of some calculations related to burden of disease, or whether it is necessary to have some supervision from the cost action members?
Yeah. So to some extent, we will be able to provide such a template. So I've mentioned the DALI calculation checklist, which will give a summary of the key assumptions, the key steps that are required in a DALI calculation. So that can already help a lot. Specifically for the national burden of disease studies, there will also be a roadmap developed that will describe the different steps. Um, but in from our experience, we also know that it's not easy to learn how to do a burden of disease study just by looking at a piece of paper and a theoretical description. So indeed, the best way to learn how to do it is to start doing it, um, possibly with the supervision of more experienced researchers. So there as well, we can play an important role. We can help people link up to other burden of disease enthusiasts, even within their own countries, because we also see that within certain countries, different groups are working on burden of disease without necessarily having a good interaction. So what we try to do at the European level, bringing people together, is definitely also something that we want to encourage at the local level. And during one of the previous workshops, we have heard from Lorenzo Monasta presenting on the Italian GBD initiative, which is really a national network from the north to the south of Italy of a very large number of Italian researchers working on burden of disease. So we also want to support these national within country collaborations.
Thank you. So I would like just to publish the the to publish this very interesting comment, but somehow
Yeah,
I cannot. But
yeah.
it is first of all, the question is, will the cost action be extending due to the problems with COVID?
Yeah, that's indeed a very good question. So this is a question by Lorenzo. So a very good question that has kept us busy in the background, ourselves and many other cost actions, of course, since several months. Unfortunately, the answer today that we can give would be no. So at the moment, there's no provision from the cost association to extend ongoing cost actions, which is of course very unfortunate because we are very much handicapped by the limitation and the impossibility to have physical exchanges. But I know that the discussions behind the scenes are going on with the cost association, also with the European Commission, to make sure that we can still make the best use of our time and of this network. But yeah, indeed, a very good question, and unfortunately, I don't yet have a very satisfying answer to that.
Thank you. Now we have another question. It is the question from Romana Hanev. She says, are the online training school free of cost or need to pay a fee for that?
Yeah, it's also an important question. So the training schools that will be provided during the lifespan of the cost action will be free of charge. The cost association will help us to pay for any possible expenses that we would have for the course material, for instance. You mentioned the online training schools. If there would be face-to-face training schools, then the cost association would, of course, reimburse your travel and accommodation. But in any case, the training schools that we will have and all the activities that we organize as part of the cost action will be free of charge. The only limitation would be for a certain group of non-European participants, because there the cost association allows them to participate, but unfortunately doesn't allow them to get reimbursed for their expenses. So this is a caveat that we have to add, but for people from France, of course, this wouldn't be any problem at all.
Romana, also thanks for taking such an interesting and needed initiative, and she is also thanking for this very nice presentation. Now we need to go further with the presentation. The next presenter is Dr. Elena Palari. Dr. Elena is a methodology researcher at the University College London, and her interests include clinical practice guidelines and evidence-based policy making. Elena, floor is yours.
Thank you very much, Milena. So good afternoon, everyone. Very well said by the previous presenters, both Brecht and Juanita, who gave a really good overview of the EU burden of disease cost action. And today we're also asking for your input and your expertise to join our network. As part of this process, along with my colleague Henk, we're leading the Knowledge Translation and Health Policy for Burden of Disease Studies work package. So as part of this effort, we were very lucky when we had our meeting back in February, before COVID and lockdown got us in this situation. We had 29 participants who took part in the workshop from 17 countries. And the focus was on the following three themes: how we can build international activities to strengthen knowledge translation for burden of disease studies, how we can synthesize good knowledge translation, and develop a knowledge translation roadmap using better and worst case scenarios. So the first theme, the participants basically focus on three areas. They input around investing in building international relationships and partnerships, and the process of doing this, as well as the output. So I'll start from the top. In terms of reaching out to established organizations, there were suggestions from the participants on reaching out to the World Health Organization, as well as taking a comparative approach as to what other countries are doing at the moment and to see how we are performing. As part of this process, the suggestions were basically made around taking advantage of the changing EU landscape, the importance of the global and the local context, as well as the opportunity to learn from successes and failures. As part of this aspect, sharing experiences and data from other countries was something that was emphasized as part of this process, as well as the learning methodologies, raising local problems to the regional level, as well as using established European structures and policies to strengthen the capacity of using such evidence from burden of disease studies in practice. In this aspect, there were also suggestions around using or conveying powers, having expert meetings, including having an input from international treaties or groups that had a voice, including patient groups or economic agencies, and as well as the importance of communicating this clearly with the science media and building a communication bridge between, the researchers, statisticians who develop these models and international scientific journalists. And the idea is to be able to strengthen this capacity, build international databases, to have what we need in order to have comparative metrics, and being able to use this for health policy making. And as part of this output, there were suggestions made about perhaps using simple video messages from key international organizations to raise the profile and the importance of burden of disease studies, as well as using high-profile public figures. There were also discussions about the use of infographics and social media to enhance this. And at this point, I would like to link this somehow to the second theme, which is about synthesizing such good practices. And I thought this was a very good example, because one of the teams, the workshop, provided this infographic and shared their view around, involving different stakeholders, as well as using, obviously, infographics to share, technical terminologies and data in a more simple format, as well as preparing policy briefs. The importance, I guess, at this stage to note is that, we need to be selective, and we need to move from that uncertainty to the certainty stage, so that we have more clarity about what is needed to be done and how this can be used in practice for the patient, for the benefit of patients and population groups. Some of the suggestions were made around linking these data and the various indicators to cost metrics, show savings or improvement in health outcomes, as well as having databases for country comparisons, and using not a one model fits all, but rather a tailor-made approach, so that this can be of benefit to decision makers. The third theme of this workshop was a focus around developing a knowledge translation roadmap. And the participants basically suggested 3 sub-themes within it. First, they raised the importance of about what do you think is important. Secondly, what your contribution will be. And finally, what do you want to get from this? And as part of this process, they discussed, again, the need to provide easily understood and clearly communicated information for decision makers. Use, for example, disability indicators, but then link this, for example, to the so what question as to what can be done to increase life expectancy. And the emphasis on what and how we think then the politicians would listen to it, then we would need to have this link between those consequences. What does it mean? How does it translate to practice? Are we talking about cost savings? Are we talking about better health outcomes? Would a lower burden of disease for a specific country mean that, it's something that has to be neglected in terms of putting funding and more research into it? Or is this relative compared to another member states, for example, especially we're comparing smaller to larger European countries? Another important aspect was raised by the participants around knowing the audience and asking for feedback. And again, this is something that we're trying to do here, being advocates of the EU cost action, to ask for your input and expertise. And what do you think is important about going on this? Secondly, around the contribution, again, the emphasis was on using infographics, flowcharts, maybe figures, so that can guide decision makers. Also, the idea of using innovative issues, for example, years of life loss or years lived with disability, how does that apply to specific groups? What does it mean? And again, the importance of this contribution is to get the engagement and contribution from those groups in order to get their input into how we can use this evidence for the benefit of those patient groups and specific targeted population groups. And finally, the third theme around developing such a knowledge translation roadmap was, so what do you want to get from this? And the participants from the workshop said that they would like to see stronger participation, for example, from public health institutions. And again, this links to the whole engagement and having a higher level up input into this process, as well as publication or participation in Congress, or for example, from members of the European Council, members who sit on advisory committees, so that they can see and experience first-hand evidence and how they can use this for health policy making. And the final aspect was around the education and training, which was also raised previously by Brecht, and the ideas for having the workshops and the online courses and going forward. Because the point for making this possible and developing such a roadmap would be to have engagement from different stakeholders and groups and different collaborators in order to have our priorities right. So again, the theme, if you like, of this and the outcome out of this workshop, and it was a strong emphasis on having engagement with the appropriate stakeholders and co-ownership, meaning that whatever we develop, it will be done in partnership with the different groups, with decision makers, with local funders who have a voice and have suggestions and ideas of how to go about this. We cannot come up with a model that we would like to use. So at this stage, I would also like to say that our focus is co-development in practice, meaning that we will be doing this in partnership and in collaboration with the rest of the members of the network. And the focus of knowledge translation is around, for example, a guideline or an evidence-based practice model, or an implementation program, or something that is tangible or in a usable format that can be used by researchers, by policymakers outside even the network. Secondly, when it comes to the aspect of developing a health policy framework, we use the health policy triangle, which is around the context, the content, and the processes, which are all interlinked with the various actors, in this case, the various stakeholders in each country, which is why we need to be doing even case studies and analysis that are specific and tailored to a given country, rather than coming up with a model that we think is applicable to all European and not only countries. And finally, the implementation challenge, I think, here for all of us is how we can convert a piece of evidence into a usable format that is then linked back into the whole knowledge translation. And maybe that will be in a specific format or a software or an algorithm that can be used by different groups. So at this stage, I would like to ask for your input. If you can please be so kind to have your suggestions or maybe your experience and type this in the chat room. The first topic is, what do you think is the most important obstacle in your country around knowledge translation of burden of disease studies into the whole policymaking process? And secondly, how could we improve basically knowledge translation of burden of disease studies? So this is something for you to consider and reflect, and we would very much like to have your experience and input into this. And I will move on to finish off with the conclusions from this workshop. So basically, the participants came up then with 5 main points around the next step of going around the knowledge translation of burden of disease studies. And this includes making an inventory of good practices, using, for example, DALYs or other indicators that might be more appropriate and make more sense for specific groups. The other point was to consider even a diagram, as aforementioned, or infographics, or guidance around the steps, but also around the challenges and opportunities that you have experienced and they have experienced, and people who have been working with such data to share with us. The fourth point was, again, on the use of plain language and in a usable format so that policymakers can understand. And maybe we can use something like best and worst case scenarios to see what works and what doesn't work in practice. And finally, around the estimates, we have discussed this before, how these are published. But when it comes to knowledge translation and health policy, I think what we need to focus is around the impact, which is not evaluated, and it's something that will make that difference from using that evidence into practice. So our focus should be on those things. At this point, I would like to thank you very much for listening and thank all of our participants and collaborators in this work.
Thank you, Elena. Very interesting presentation. Well done, Hank said. Well done, Elena. So your colleague, co-author of the presentation, encourages also all colleagues from auditorium to actively discuss the options to be more included or more engaged in the collaboration about translating the burden of disease results into the policy. So I'm looking at the moderator section, and I see a question, so I will publish it. So yes, I do this, but hopefully I will ask how to make sure policymakers see our results. Are there any skills needed to be developed for infographics, for creating infographics? And can both studies result in a very high number of infographics and making them difficult to distill the message?
Elena, you're muted, sorry.
Elena, we can't hear you.
Yes, I'm sorry. I said very good question by Brecht. Yeah, thank you for that. Indeed, it can be very difficult to engage with policymakers and make this work. And I think that's where the challenge is when it comes to knowledge translation and health policymaking and raising the profile of burden of disease studies with respect to this process. And I think really is making sure that we do code development in practice pragmatic, meaning that we need to speak to and reach out to these policy makers, individual groups, patient representatives, maybe even start from the bottom up to work our way higher up the ladder. And that means even reaching out to people from outside our department and our network and within each country to see who are the key players, and maybe send a newsletter, send something simple. And absolutely, as Brecht said, infographics can be a bit tricky when you have a high number of estimates and how you present this information, because it's so complex and you need to maybe have a figure, but then how do you even explain that figure in an infographic? And I think that's where the participants of the workshop suggested video messages and social media. So maybe we can start the discussion and have this communication built up with the public, with the different groups. And it is a process, so we cannot expect it will be done from one day to the other, but we need to make this happen from very small changes.
Thank you, Elena. Now I see that we are coming to the end of our session very closely. So I would just like to, I'm sorry for this echo, but I would just like to add a few comments from your colleagues Santos and Dimitri. They said there are various kinds of reports and and pitch presentation and media that should be used to convey the message to policymakers. And also, they agree that more communication through media and media training are needed. So I would like, if there is no one who wants to comment, I would like kindly to ask Brecht for closing remarks and wrapping up a session.
Yeah, thanks a lot, Milena. So maybe I can invite all the speakers to show their camera again so that we can see each other again. But indeed, I want to thank everyone, all the speakers, all the members of our cost action who participated, and all the other attendees to be here during this session. Also, a very important point that I forgot to mention. So apparently, the World Congress has saved the best workshop for the end of the Congress. So later this evening at 7:45 p.m. Rome time, we will have our last European Burden of Disease Network workshop, where Juanita and Elena will unravel all the details, everything you ever wanted to know about the calculation of years of life lost and years lived with disability. So later this evening, we will have a more methodological, technical session on the calculation of DALI. So again, aiming to help support the capacity development across Europe and beyond. I also want to thank Francesco, who was so kind to host us today and to help us with all the technical aspects of this this workshop, which went very well, I must say. So yeah, thanks to all for your kind words also in the chat, for being here with us. And we will see each other soon, some way or the other. So thanks a lot and have a nice evening, and hope to see you later this evening. Thank you.
Thank you. See you.
Bye-bye.
Bye.
Thanks.